So this is a systematic review that looks at the prevention, causes, and management of running-related ankle injuries. This is something that I've kind of been working on for years, just as an own participant getting running-related injuries. So running is one of the best things you could do for exercise and for longevity, cardiovascular, musculoskeletal. Great thing to do, and especially with COVID that happened a few years ago, there was a large increase in the amount of runners and amount of running that people were doing, either as a coping mechanism or just a way to go out and do something. So with that, there was more running, and that resulted in an increase in running-related injuries, and specifically to the ankle. So in this specific study, we're looking at 3 distinct ankle injuries, which contribute to 15% of the overall sports-related injuries that happen nationwide. The first one being Achilles tendinopathy, the second peroneal tendonitis, and the third are regular ankle sprains. The way we did this was we scoured PubMed, Sinal, and Embase and looked for randomized control trials that also fit our other major criteria that needed to be addressed, and of which we received, I think, 14 articles that were actually included in the study. 33% were on Achilles tendinopathy, 17 on lateral and medial ankle sprains, specifically the peroneal brevis tendon, and then a 5% on foot core strengthening and injury to facilitate recovery. So one thing that's very big is the materials you're using for running. There's really only one thing that you can kind of use, and those are shoes. So having the proper running shoes could be the primary determining factor on how you can prevent injury or kind of manage or mitigate how you return to sport following an injury. One thing that has been used in the past are high drop shoes, which means the drop from your ankle to from your heel to your toe increases roughly between 8 to 12 millimeters. Now, this is great for long distance running where you need that extra padding and cushioning on your heel. But when it comes to shorter distances, like 5 or 6 miles, then that could actually be hurting your knee by putting the forces up there as opposed to the ankle. So having the correct drop, and drops go from 0 all the way to 12. I've raced on 8 and 12s, and they were not fun. Now I'm going more to the minimal, which is 0, and it feels much easier on the ankle. So I'm definitely excited about where technology is going, especially with those aspects. You can also get custom-made foot orthoses, which are kind of a hassle to make, but especially with newer technologies that are being developed, like carbon fiber, which is making everyday shoes. I think this can definitely be a great way to rehabilitate or strengthen shoes to reduce injury or return to sport. So those are my major findings. Some considerations for the future are, is plantar fasciopathy considered an ankle sprain? That's something I kind of need to determine, because it is a foot ankle complex, so that's to be determined. Are the ankle sprains the same in children and the elderly? I know there's growth plates in children versus elderly. They might just not heal, especially with vitamin D, calcium, all that stuff going on. And of course, the thing that I'm most interested in is what happens when carbon fiber hits the market, and we can actually use those for orthoses. So very exciting field to be looking into. And that's all I have. Thank you.